Podcast is now starting. All attendees are in listen-only mode.
Good morning, good afternoon, good evening to all of you wherever you are in the world. We have a record number of registrants for this webinar, I think thanks to the many co-hosts and co-sponsors who have joined in this process with us. My name is Mark Canavera. I am one of the directors of the Care and Protection of Children, or CPC Learning Network at Columbia University, with also nodes as a network throughout the world. And we are so excited to partner today with a number of other research and learning groups to present this webinar, presenting the latest research on violence and child protection outcomes from some cash transfer studies that UNICEF's Office of Research in Achenti has been leading on. Before I get to introducing our presenters today, whom you may be able to see on their webcams already, I wanted to introduce our co-hosts for this event. Obviously, UNICEF's Office of Research in Achenti is one of them, and all of the speakers who will be presenting today come from that office. The World Bank's Gender Group also helped to pull this webinar together and to spread the word among a really new and exciting constituency for those of us who are working in child protection. And then that is people thinking about international development projects and monetary institutions like the World Bank. So thank you to Diana and all of those at the Gender Group at the World Bank. The Transfer Project, whose work you will hear about over the course of the webinar, is another co-sponsor, as is the Alliance for Child Protection and Humanitarian Action, which has a cash and child protection task force that is asking some of the questions that we're going to hear about today. Before I present our illustrious panelists, I wanted to also point out that if you send us questions through the question box or the chat box, we will be monitoring those throughout the course of the webinar. We will also record and bring them to the panelists at the end. We expect that today's webinar, given the substance, which is quite meaty and significant, will last about 45 minutes, and then we're hoping for another 30 minutes of Q&A at the end, so about an hour and 15 minutes total. If you can't stay for the whole thing, do not fear. We will record it, and it will be available on ours and other websites. We will also be, in 24 hours from the end of the webinar, you will receive a follow-up email that will include links to not only the webinar recording, which will already be uploaded by that point, hopefully, but also many of the studies and pieces of research that the panelists will be presenting today. So don't worry about where you'll get access to those. A lot of them are already open access, and we will send those right along one day from today. Moving on to our panelists, who are joining us from a variety of locations, but all through the UNICEF Office of Research in Achenti, are Tia Palermo, Amber Peterman, and Jakob de Hoop. Tia is a researcher and social policy specialist at the UNICEF Office of Research in Achenti in Florence, Italy, where she conducts research examining impacts of social protection on health, violence, and well-being through a range of experimental and quasi-experimental designs. She holds a PhD in public policy from the University of North Carolina at Chapel Hill and has previous experience as a researcher in academia and with international NGOs. Welcome, Tia. Amber is jointly affiliated with UNICEF in Achenti and the University of North Carolina's Department of Public Policy. Her research focuses on gender and development issues, including linking economic factors to gender-based violence, with a focus on sub-Saharan Africa. Welcome, Amber. And finally, Jakob works at UNICEF Office of Research in Achenti, where he supports the Transfer Project, one of the co-sponsors of this event. His research examines how social protection programs implemented in developing countries and humanitarian contexts affect children and adolescents. So welcome, Jakob, who has such a lovely last name, de Hoop, just like hope, which we need more of in the world today. So with no further ado, I'm going to change the presenter to, I believe, Amber. Is that right?
Yes.
Okay, and then we should all be seeing Amber's presentation come up. There it is. And again, don't hesitate to send questions to us through the question or the chat box. Oh, goodness, I almost forgot our polls. So for all of you who've joined us, and there are already 150 of you, 152, I'm launching, what region of the world do you come from? So we are all seeing this. Please tell us where you are today. Polling. I'm going to close it. We've got a 70% vote rate, which is pretty good. 5, 4, 3, 2, 1. We have 80% of you voting, and oh goodness, it looks like 41% of you are from Europe, 34% from the Americas, 14% from Africa, and 10% from Asia. Surely a function of the time zone in which we have organized this. So we hope that those in Australia and the Pacific and Africa and Asia are able to learn about this through the recording. Just to close, cancel. Then I will run one more just to give us a sense of who you are. Which of the following do you primarily consider yourself? A researcher, practitioner, policymaker, or other? We will leave this up for just a few seconds. We're already at a 50% vote rate of the 165 people who've joined us so far. 76, 80. So let's close this in 5, 4, 3, 2, 1. We have a largely practitioner audience today, which is no surprise, given the nature of the CPC Learning Network that tries to make research available to everyone, to practitioners to improve their work, but also many of our co-sponsors focusing on that same mission. A number of researchers as well, 32% of you. Just 6% of you are policymakers, but an important 6% since you'll be making the decisions that affect our lives, and about 15% other. Thanks for doing those polls. And with no further ado, I will pass the microphone to Amber and team. After each short presentation, we'll take a minute or two for clarifying questions, and then do a nice, robust Q&A at the end. Over to you. Thank you.
Okay, so hi everyone, and thanks a lot, Mark, and to the CPC and all the co-sponsors for allowing us to present some of our work today, and to all of you for joining. So as Mark said, we're all affiliated with the UNICEF Office of Research, and this is a small research branch of UNICEF located in Florence, Italy. And there's about a dozen of us who work on social protection, primarily through the Transfer Project in the office. So we often get a lot of questions about what is the Transfer Project. So I thought I'd start with a few slides on that. For some reason, I'm not sure if all of you can see my screen. Mark, you can jump in and let me know if something's wrong.
We can see it just fine, or at least I can. And if others can't, please just
something different, so
let us know. Great.
Okay, so the Transfer Project was created about 10 years ago, and it's an institutional partnership between UNICEF, FAO, and UNC. So we work in close collaboration with national governments and research institutes, and you can see from the map we're mostly in Eastern and Southern Africa, so about 12 countries now. We've grown a lot. So there are two primary objectives. So one is to first just create the research around large-scale national government-run cash transfers, and these have typically been unconditional cash transfer programs. But then, of course, the second objective we have is to take kind of the evidence and inform debate, program design, dialogue, and learning in the region. So we spend a lot of time Oh, there we go. So we spend a lot of time doing more than just publishing in peer-reviewed journals. So we create a number of different products, infographics, policy briefs, organized meetings, and so forth. And we also have a book that was released a couple of years ago named Evidence to Action, which kind of talks through some of the dialogue around how different evidence was used in the policy decisions in a number of different countries. So I'm not going to go in a lot to discussions around generally what are cash transfers and what is the evidence around them, but there's a lot more products on our website, and I certainly encourage everyone to go and take a look if they're interested. So there are a few things we want to do today. As Mark said, first I will give kind of a quick overview of 2 recent reviews that we completed focusing on intimate partner violence, IPV, and violence against children. And then Tia and Jakob will give a couple different case studies, Tia focusing on Ghana and Jakob focusing on a few different cash transfers for the education of displaced children that he's been leading. Okay, so to jump right in, the main paper that I'd like to discuss is one that was recently published in the World Bank Research Observer last month. And this is a collaboration between the London School of Tropical Hygiene and Medicine and the International Food Policy Research Institute and ourselves. And the paper has a few different objectives. So first, we just wanted to kind of take stock of a number of different studies and the kind of increasing evidence that's coming out around cash transfers and intimate partner violence, focusing not only on the impacts, but also trying to understand the mechanisms underlying the impacts. And then taking that kind of body of evidence, we wanted to build a program theory linking cash and intimate partner violence. And we wanted this to be something that could guide future research and something that was accessible both to development economists working on cash transfer evaluations and social epidemiologists who are more focused on understanding drivers of IPV. And then, of course, to take that all together and see if we could distill some program design features which seem to be important for impacts in the field, and talk about the potential research gaps and research agenda going forward. So we started out doing kind of a scoping exercise and talking to both practitioners and to researchers, and then moved forward to kind of a more formal search of electronic databases. So in total, we found about 14 quantitative and 8 qualitative studies. And these were studies that were published looking at either physical, sexual, emotional, psychological violence or controlling behaviors between marital, cohabiting, or dating partners. So these included both evaluations of conditional cash transfers, CCTs, or unconditional cash transfers, UCTs, as well as one-time lump sum transfers, as long as the transfers were made for kind of a general use. For example, we didn't want to include studies that were primarily livelihood or microfinance initiatives, but that just happened to give a little bit of cash at the beginning. So we want to focus in on these monthly or bi-monthly sustained kind of social safety nets. We also included programs that were bundled, so that also has some kind of other complementary program as part of them. And we had some different criteria as to the rigor of the research included. The quantitative studies we only included if they had an experimental or quasi-experimental design, and we assessed qualitative work using a Quoric assessment tool. And there's more about these methods in the paper if anyone is interested. Okay, so in total we found 22 studies, which I think is a lot more than we expected at the outset. So on the left-hand side, you can see the type of program that was included, and the blue is quantitative studies, and the purple is qualitative studies. So you can see that kind of the majority of the studies were conditional cash transfers. However, there were also many plus components, both for conditional programs and unconditional programs. You can see on the right that the studies were highly skewed towards Latin America and the Caribbean. There were only 5 studies from Africa and only 1 from each of MENA and Asia. So a few kind of other interesting characteristics about the programs. Nearly all of them targeted women, with a few exceptions, and a substantial part of them were government-run programs. And these, like I said before, typically are the type of program that transferred either bi-monthly or monthly small amounts of cash, equating to about 6 to 50% of pre-program baseline consumption. Okay, so here are the high-level results. We found overall in the 22 studies, the majority of the studies, about 3 out of 4, showed decreases in intimate partner violence. So on the left, you can see the overall impacts, where again, blue is quantitative and purple is qualitative studies. So apart from the large number of decreases that we found 2 studies that had mixed findings. So this means there were actually increases and decreases in the same study, depending on the different indicator that was looked at. And in about 4 studies, we found no relationship at all. So when you look on the right-hand side, you can see the quantitative indicators. So there were 56 total across the 14 quantitative studies. And you can see the green are decreases, the orange or yellow are increases, and the gray is not significant. So overall, across the quantitative indicators, 36% of them were significant decreases, while only 2% were significant and positive. So kind of the main takeaway from our overall findings is that yes, we find many studies, the majority, that find decreases in IPV. However, these decreases are concentrated in physical and sexual violence rather than emotional or other types of violence. And so I think there's a number of different hypotheses why this would be, and I think one of them is a measurement story. So physical and sexual violence tend to be measured using many different behaviorally specific indicators, where emotional violence and other types tend to be measured by fewer, and they're also kind of more apt to be culturally specific. So another kind of interesting thing about these findings is that when we do find reductions, they are quite large. So the reductions often are 30% or more of pre-program baseline levels, so quite large. So we tried to kind of gather all the evidence across these papers and say, okay, well, what is actually going on here? And after many iterations of drawing different figures, we think there are 3 different main pathways. So if you look on the left, you have the cash transfer characteristics, such as size, frequency, and duration of the transfer. You have immediate outcomes that the transfer will generate, for example, cash inside the household, and leading to these 3 pathways. So the first pathway we think is operating within these studies is a pathway of economic security and emotional well-being. So the increased economic status of the household leads to better kind of emotional well-being inside for any member, which could lead to decreased IPV. The second pathway is one of intra-household conflict. So on one hand, increased availability of cash to meet daily needs can lead to fewer arguments and triggers for violence. But on the other hand, especially if people have different ideas of how the cash should be spent, there could be an increase in conflict inside the relationship, leading to increased IPV. And the third pathway we found evidence for is one for women's empowerment. So especially if women are receiving the cash or complementary services, they might have enhanced self-confidence, efficacy, financial autonomy, and so forth. This will lead to shifts in the relationship power between her and her partner, and kind of the ultimate impact on IPV will depend on kind of how the partner reacts to that newfound power. So if the partner is accepting, it may lead to decreases. If the partner is kind of feeling threatened and wants to kind of assert their authority, then this may again increase IPV. So we see these 3 different pathways and hypothesized in the papers, and they kind of lead to different effects on overall IPV. So I wanted just to give you a quick kind of understanding of how much evidence we actually found for each of these pathways. So the first one, economic security and emotional well-being, we found support for this in 4 quantitative and 5 qualitative papers. However, there is a large kind of body of literature looking at cash transfer impacts, systematic reviews, and so forth that supports this pathway. And here's a quote from a male who was receiving a cash food or voucher program in northern Ecuador, kind of saying, well, the economic resources improved kind of household harmony and the relationship with his spouse. So in contrast, the second pathway was supported almost entirely by qualitative work. And we think this is mostly because quantitative evaluations just aren't really measuring these types of things. However, there is a body of literature that supports kind of steps along the way in the pathway. And this is a quote from a female who was receiving a CCT plus in-kind transfer in Turkey. And she's explaining how, I used to ask my husband for money, and he used to say there's no money, and that's when the fights used to start. And because of poverty, not only for us, but for all poor, fights come from suffering. So this kind of pathway really is evidenced mostly and comes out strongly in the qualitative work. So the final pathway was supported by almost all of the quantitative papers and about half of the qualitative papers. This tends to be the pathway that a lot of the economic evaluations point to, that these kind of impacts happen because of women's empowerment. And this is a quote from a female in northern Uganda who was receiving a non-conditional cash transfer, saying that kind of, now that I have my own money and am able to have kind of a small business, this is how I've escaped issues of gender-based violence. Okay, so now the hard part came in while we were looking across all this evidence and saying, okay, so what are the common program design features that allow us to make the conclusion that the cash is actually decreasing IPV? And this was very difficult to kind of come to a set conclusion on, because most of the evaluations did not actually, they were not designed in a way to be able to unpack these program design features in a rigorous way. However, we do think that the intra-household relationships are key. So what happens between the partners when the cash enters the household is kind of the determining factor in what the ultimate impact will be. So we think that small design features that allow women to retain control of the transfer, so this could be messaging, size, and frequency of the transfer, are kind of key into making sure that there are no backlashes and making sure that kind of this women's empowerment pathway is leveraged for impacts. So likewise, the female as the transfer recipient appears important, but again, there are few studies that actually are able to test this. And then kind of the wild card is the plus component. So we know that there are programs that decrease IPV, but these haven't really been integrated into cash transfers in a meaningful way, with attention to the cost of implementation and the potential trade-offs in delivering a kind of more substantial, heavier program versus a lighter cash transfer. So this is kind of like the next generation of research would need to really dig into these if we want to understand the mechanisms and behavioral impacts a bit more. So in conclusion, we think that the review that we've done does show that cash transfers are a proven structural intervention that has potential to decrease IPV kind of at scale, and we don't think that this is something that will replace vertical program, but we see it more as a complement to vertical programming. However, there are many different geographical and program design gaps. As we saw that there were very few programs from other regions apart from Latin America and Sub-Saharan Africa. We think that there needs to be better measurement and analysis of mechanisms. Many of the studies just weren't set up to look at these. And we think mixed method evaluations are really key to this, to be able to talk about both the impacts as well as kind of the underlying dynamics. And then finally, kind of as we advance, cost effectiveness measures need to be kind of integrated into some of these evaluations to compare the relative cost effectiveness to other types of programming. So I just wanted to take the next few slides before my time is up to talk about another review, which was done jointly with Tia and several other colleagues at Intercenti. This was funded by the No Violence Initiative and published last year in Health Policy and Planning. And we had kind of a similar objective to look at the effects of social safety nets on violence against children. And I will say from the outset that this paper was much more complex. It was much more complex for a number of different reasons, but one of them had to do with measurement. So there are many different types of measures of violence against children, and these vary across the age ranges. The ethical issues are more acute, so evaluators who are looking at impacts of cash transfer programs are much less likely to want to include them in their surveys, so I think it's just much less studied. And then also the mechanisms are more complex. So you have violence in different spaces, the home, school, in labor settings, and you can imagine that there could be effects that kind of offset each other in these different settings. In addition, you have violence from different perpetrators, both inside the household and outside the household, and more indirect pathways. So I'm not going to show you our conceptual framework for this paper. However, you can find it in the publication, and I'll just say that it was just a much more difficult task in comparison to the review on IPV. So I did want to show you our overall findings for this review, and we found 57 indicators across 11 studies. And so you can see in the different colors are the different types of violence, and in kind of the percentage there inside the pie chart are the number of significant protective effects that we found across the studies. So in total, about 1 out of 5 studies showed a protective effect of a social safety net. We found no adverse effects. However, these kind of positive impacts really vary by type of violence. So you can see that for sexual exploitation and sexual abuse, the indicators in red, there were kind of more substantial decreases in violence, whereas there were fewer for other types of violence, like violent discipline, peer bullying, and so forth. And I think it's interesting because these kind of types of violence were really regionally grouped. So most of the sexual violence and sexual exploitation studies came from sub-Saharan Africa, whereas most of the violent discipline studies came from Latin America. So I think it is interesting to kind of contrast these two papers in the sense that we were doing almost the same type of review. However, there are almost no papers that overlapped. So basically, either studies were looking at intimate partner violence or they were looking at violence against children, but they weren't kind of looking across the household. So that said, some of our conclusions are quite similar. So we think results are promising for adolescent girls and for sexual exploitation and abuse, but less so for other types of violence. The regional and kind of evidence gaps are very similar. There's a lack of comprehensive studies here showing how social safety nets can affect multiple types of risks of violence for children. So looking across different settings, studies tended to only look at one. And the mechanisms here are quite diverse and need to be unpacked. And finally, for violence against children, similar to our previous review, there was a lack of studies able to test plus components, including linkages to integrated child and social protection systems. So we think that really since social safety nets are almost never going to be designed with the primary goal of reducing childhood violence, this is really the area that we kind of need to move into, both for research and testing interventions. So that's all from my side, and I will turn it over to Mark.
Thank you so much. And just wanted to spend a minute or two for clarifying questions. We do have a number of questions that have come in that seem to be much more substantive that I will bring out at the end. But, you know, in terms of clarifying questions, please do send a few in. Here is one from Elena Gaia that seems to be a clarifying question. Did the cash transfers that you reviewed for both IPV and violence against children include these issues as objectives of the cash transfer from the beginning, or was the impact measured ex post and separately from the original design?
Right, so I think that across the board, at least in the IPV paper, these are cash transfers that were designed for food security and poverty-related objectives, and exactly somehow IPV got into the questionnaire and people were interested in looking at it, but it was never kind of an objective. So whether or not these studies had kind of pre-analysis plans specifying IPV, I think is another question, but definitely these were not programs that were designed for violence in mind.
Great. The rest are really quite substantive, so I think we will move on, and I believe Tia is going to present next. And don't worry, if you've sent a question, we will be regrouping all of those and we'll have a nice lengthy Q&A at the end.
Thank you very much. So as Amber mentioned in the IPV review, there's very promising evidence that cash transfers can reduce intimate partner violence. However, there are some gaps, and these include some regional gaps. There's little to no evidence from Western or Central Africa. There is gaps in the evidence around frequency and severity of violence. And also, as Amber mentioned, the mechanisms or the pathways. There's little quantitative evidence on the pathways through which cash transfers can reduce intimate partner violence. So in Ghana, we at Innocenti Office of Research, we led an impact evaluation of a government cash transfer program called the Livelihood Empowerment Against Poverty. And this was an expansion of the existing program. And together with the University of North Carolina and in Ghana, the Institute of Statistical, Social, and Economic Research, as well as the Nambrango Health Research Center, together we examined this expansion on a range of indicators related to poverty, consumption, and other primary program objectives. And in this one as well, intimate partner violence was not an objective of the program. It's largely an anti-poverty program. But we measured intimate partner violence, and we wanted to examine whether a government social protection program targeted to extremely poor rural households with pregnant and recently pregnant women in Ghana had an impact on past year prevalence and frequency of IPV. We also wanted to understand through which pathways was this working, and try to understand as well if family structure matters. So are there differential impacts between polygamous and monogamous households? And so this is work done in conjunction with Amber and our colleague Elsa Bali, also on behalf of the LEAP 1000 Impact Evaluation Team. So this program is part of a government-led, nationwide, unconditional cash transfer program. So there are no behavioral requirements that households need to comply with in order to maintain eligibility for the program. And the objectives are to alleviate short-term poverty and encourage long-term human capital development. Specifically, the idea was to target pregnant and women with a child under the age of 12 months in an effort to reduce malnutrition and stunting, which was particularly problematic in northern Ghana, where this expansion was first piloted. The program targets pregnant women or women with a child under the age of 1 year. And it consists of a bi-monthly regular cash transfer payment. And in addition, an innovative plus component was a linkage to the National Health Insurance Scheme. So households that were enrolled into this LEAP 1000 program were eligible for a premium waiver. So they could enroll into NHIS without having to pay the premium. However, this enrollment was not automatic. Households did have to enroll themselves, but they were eligible for this premium waiver. So the idea is to link the cash transfers with health insurance in an effort to improve the health and well-being of the households. The initial coverage of this expansion of what's called LEAP 1000 was 6,220 households in 10 districts in northern Ghana, and this is in the upper east and northern regions of Ghana in 4 districts, and the map is on the slide here. And the evaluation sample that we used, or the design that we used, was a quasi-experimental design. So this was a 2-year mixed method study using quasi-experimental methods and a longitudinal design. So originally there were approximately 8,000 households targeted by government who were assessed for eligibility. 3,619 of these households were deemed eligible, and eligibility was determined based on what's called a proxy means test. So enumerators went into the household and assessed assets and other characteristics of the dwelling and demographics of the household to determine a proxy means test. And households who fell below a certain threshold were deemed eligible, and those who fell above the threshold were ineligible. So the study design used what's inspired by what's called a regression discontinuity design. So the idea being that those households immediately above and immediately below the threshold of the PMT score are, for all intents and purposes, very similar to each other. And so we exploited that threshold, and we collected data on households who were just above and just below that threshold. So those who just missed the qualifying cutoff are the comparison group, and those eligible, of course, are the treatment group. We collected both quantitative and qualitative data, as well as community and health facility data in July through September of 2015 for the baseline. And we went back last year between July and September of 2017. Because of the sensitive nature of the questions, particularly the intimate partner violence questions, only female enumerators were used, and the interviews were conducted in privacy. The final evaluation sample was 2,497 households, and for the purposes of the IPV study, the final analysis sample was 2,083 women. We looked at a variety of IPV outcomes that were based on the modified conflict tactics scale. So we first wanted to understand whether women were experiencing any violence in the prior 12 months, and then to fill some of the gaps in the existing research, we then assessed frequency of violence. So for each of the items asked, women could respond that this never happens, sometimes, or often for each item. So we asked questions related to controlling behaviors, emotional IPV, physical IPV, sexual IPV, and then a combined measure of emotional, physical, and sexual IPV. So there's a lot more detail in the paper, but for controlling behaviors, we had 7 questions, and we used a raw score combining the binary indicators. Then for the other measures, we standardized these scores by first adding up the items of each type of violence, and then subtracting the control mean and dividing that by the standard deviation of the control group. So we have a standardized measure for the frequency. When we did the impact analysis, we found that there were no reductions in overall experience of IPV among the full sample. However, among the monogamous sample, the LEAP 1000 led to a 5 to 8 percentage point decrease in the overall experience of IPV. And this was seen particularly in the emotional and physical IPV indicators, as well as the combined indicator. But there were no decreases in the polygamous sample. Then we went on to examine the frequency of IPV, and we found that indeed in the overall combined sample, there was a reduction of the frequency of IPV, and there were larger decreases still among the monogamous sample. So in the full sample, there was a 0.09 to 0.11 standard deviation decrease, and this was slightly larger in the monogamous sample. And what we see is that there are no decreases in the polygamous sample. However, this polygamous sample is the group that's at the highest risk of IPV overall. We then went on to try to understand what are some of the pathways why we're seeing these reductions in IPV. So we looked at the different categories of pathways that Amber highlighted in the review paper, and we found that there were positive impacts on the following pathways. So economic security, households were less likely to be poor and extremely poor. There was increases in monthly expenditures, increases in monthly food expenditures, and again, this goes back to the idea that because there's increased availability of funds for these types of spending, there's potentially less arguments in the household. We also saw increases in locus of control, particularly among the monogamous women. We saw increases in savings, women's reported social support, and whether or not they had a valid NHIS card. We also see among adults an increase in help-seeking behavior. So the idea here is that they're potentially linked into services where they could seek help if needed. We did not see any impacts, however, on self-perceived stress, life satisfaction, whether or not the partner was drinking, expenditures on alcohol, women's decision-making, or women's agency. So in conclusion, the LEAP 1000 reduced the frequency of emotional, physical, and any IPV in the full sample, but not the overall experience of IPV. So we see reductions in frequency, but not overall experience of IPV reductions in the full sample. However, these impacts appear to be driven by the monogamous sample. There's no impacts in the polygamous sample, which is at the highest risk of IPV. The pathways include economic standing, emotional well-being, and women's empowerment. Some of the limitations of this study is that we're looking at what's called local average treatment effects. So these are the women who are very close to the eligibility cutoff. So those women who are much more poor and who are further away from that cutoff, we might expect bigger impacts among those women. However, we can't measure that based on the study design. So these are potentially underestimates of the program impacts on IPV. And it's also possible that there's underreporting of violence outcomes, as is a possibility in any study reporting on violence. The results of this study underscore that cash transfers can improve well-being beyond the primary program objectives around poverty reduction and nutrition. And these findings also support the idea that family structures matter in designing the programs. But we know very little about how or why we saw these differences based on family structure. So we really need more research around this and qualitative inquiry, which is something we're planning on doing next year with more qualitative follow-up around this question. Thank you.
Thank you so much, Tia. I have been monitoring the questions quite closely, and we'll regrouping them, and we will bring a number of these to the full Q&A at the end. We do seem to have one or two right now that are clarifying specific to your presentation, Tia. One is from Paola Ballon. Apologies in advance to all participants for pronunciation, since I don't have the luxury of asking you how to pronounce your names. You mentioned the lack of an effect on agency, and could you clarify how agency was measured? And that's a question that was seconded by Michelle Hines, who asked, how was empowerment measured versus agency?
Yes, so that's a good question. So we asked about women's perception of their ability to make decisions based on a scale, where they've placed themselves on a specific scale, and that's how we measured it.
Great, thank you. Okay, that seems to be the clarifying questions for now. We already have about 10 or 15 questions for the full Q&A that I'm trying to regroup into categories, so it should be a very juicy discussion. Jakob, over to you for the last presentation.
Great, let me start by thanking the CPC Learning Network team for inviting us to give this seminar, and also to all the listeners for tuning in. We're moving on.
Jakob, if you could just move your microphone a little bit closer. You're a little bit soft.
I hope this is better.
That's better. Great. Thank you.
Great. So let me start over. I wanted to thank the CPC Learning Network for inviting us to give this seminar and all the listeners for tuning in. We're moving on to a different topic now, not directly related to violence. Amber and Tia have so far primarily focused on the effects of cash transfers in comparatively stable settings, but there is an increasingly strong push for increased use of cash transfers also in settings of humanitarian emergency. Think, for instance, of refugee crises and displacement settings. A report by the Overseas Development Institute and the Center for Global Development, published in 2015, played an important role in this proliferation of cash transfers in humanitarian settings. It argues, in my view, very eloquently, that unconditional cash transfers are often preferred to in-kind support in these settings. Well, I cannot give a comprehensive overview of all the arguments laid out in the report. I do mention 3 of them here, though. First of all, the costs of providing cash transfers tend to be low compared to those of in-kind support. Second, by providing cash, affected populations can increase their expenditures and hence boost local markets. And the third one, very importantly, is that cash allows recipients to use aid in accordance with their most important needs and their most urgent needs. So for instance, if they are in need of healthcare, they have the flexibility to spend their aid and go to a hospital. Subsequently, in the past 3 years or so, a consortium of the 30 biggest donors and aid providers have joined forces under the so-called Grand Bargain Agreement. And together, they have agreed to increase the use and the coordination of cash-based programming. And an independent review carried out very recently indicated that there has been significant progress in this area. So humanitarian agencies are moving towards cash-based programming in humanitarian settings, and they're improving their coordination of cash-based support among themselves. So there's a real transition process taking place. Can we go to the next slide? Thank you. Well, while there is probably consensus on many of the objectives of the Grand Bargain, there's also a shared recognition that there is a need for more evidence. The report by the Overseas Development Institute and the Center for Global Development, for instance, suggested that it's important to systematically analyze and benchmark other humanitarian responses against cash. Relatedly, a very influential World Bank report suggested that we develop a global research strategy to fill evidence gaps on the relative performance of transfer modalities. Now, why do we need more evidence? There's 2 reasons, in my view. The first one is that rigorous evidence from humanitarian settings is limited. A very thorough literature review carried out by Ducey and Tepes recently found only 5 studies that rigorously measured the impact of cash-based schemes in settings of humanitarian emergency. Moreover, and very importantly, humanitarian settings may have their own dynamics, and the effects of cash transfers observed in stable settings may not replicate in humanitarian settings. Moreover, there's many different types of humanitarian settings, and the effects of cash transfers may be different across these settings. So UNICEF Office of Research Innocenti is one of the agencies that tries to help fill the evidence gap. I would like to point out that we have a web page that links to a number of studies exploring the effects of social protection programs and cash transfer programs in contexts of fragility and forced displacement. So for interested listeners, I would suggest that they check it out. There's a link here in the presentation that will be shared afterwards. So in the remainder of this presentation, I would like to focus on some of the research UNICEF Office of Research has carried out that specifically examines the role of cash transfers in the lives of refugee children. And specifically, I will zoom in on some of the barriers that refugees may encounter in the use of cash transfers. If we can move to the next slide, please. So I will rely on two examples. The first is the No Lost Generation program in Lebanon, which was known locally also as Manila. The program operated in the 2016-17 and 17-18 school years, and it was implemented by UNICEF Lebanon in collaboration with the Lebanese Ministry of Education and Higher Education and the World Food Programme. The second program is the Hajati program, which is being implemented by UNICEF in Jordan. As a little bit of background, both Jordan and Lebanon experienced a large inflow of refugees as a result of the Syrian crisis. And in both countries, UNICEF and partners have worked very hard to make sure that local schools could absorb refugee children. As part of this, in both countries, an afternoon shift was set up that catered primarily to displaced children in primary schools. Despite all of these efforts, it was clear that many households were not able to send their children to school, and apparent reasons included a lack of funds to pay for school-related expenditures and reliance on children for income generation. So there was a clear rationale for additional cash support. Both programs do that. They provide cash support to children in afternoon shift schools. And they do a couple of additional things. They provide information to parents if children are not attending school. And they link households with what we call referral services if children do not attend school despite the cash support. Now, I will zoom in primarily on the role of the cash support, and unfortunately, the other services are beyond the scope of this presentation. So how does this type of program affect children? Maybe we can move to the next slide, Amber. With colleagues at the American Institutes for Research, we tried to answer this question for the program in Lebanon. We followed a total of 1,500 households, roughly half of them living in governorates in which the No Lost Generation program was operating. Those are the green dots you see on the map here. And the other half of the households were living in neighboring governorates not benefiting from the program. Those are the red dots you see here. And so we carried out interviews with these households before the program started operating, which was just before the 2016-17 school year. And then we went back to these same households during the 2016-17 school year and at the start of the 2017-18 school year. Now, I cannot explain in the limited time we have how we used the data to identify the effects of the program, but for those with a technical background, we used what we call a geographical regression discontinuity design. And our findings are twofold. First, we observe improvements in a wide range of domains among the children who are enrolled in afternoon shift schools. So we see that the households they live in increase expenditures on education. We observe improvements in the health and the mental well-being of children. We observe reductions in children's participation in household chores. Children, when we interviewed them, indicated that they were more optimistic about the future and they were more assertive. And concomitantly, we observed an improvement in school attendance. At the same time, and this is very important, despite all of the efforts by UNICEF and all the partners, there continued to be capacity constraints in afternoon shift schools. Many of them were full and could not accept new children. And as a result, the positive effects we observe and list here are limited to those children who had been able to find a spot in these schools before the program started operating. And this is a very important lesson. We commonly recognize that the effects of cash transfers in humanitarian settings on for instance, food expenditure may be limited if markets are closed and cannot cater to new people and cannot accommodate additional expenditure. In that case, we might observe inflation. But similarly, we might see limited effects, for instance, on education. If schools are full, we might see limited effects on health outcomes if hospitals cannot cater to additional patients, etc. So capacity constraints can hamper and limit the effects of cash transfer programs in many different areas. And these findings were reflected also in qualitative research we carried out, which is displayed on the next slide. I'm just showing 3 quotes here. The first is of a schoolgirl in a car, and she basically agreed with the positive findings. She said, "We won't end up with household chores. You need to take advantage of education and time you have to study." So reflecting the positive findings we saw in our quantitative research. Teachers also reflected these improvements. A teacher in Mount Lebanon told us that the child is now contented and relaxed. He feels he's equal to the other kids. He has his own uniform, his bag. Sometimes if his copybook finishes, he can buy another one. So the child feels more at ease and is not pressured. At the same time, especially principals we talked to indicated that indeed schools were up to capacity and could not incorporate more children. So this is one principal saying it's too crowded between Barja, Nama, and Ramele regions. The surroundings, it's full. Later on mentioning there are plenty on the waiting list. The ministry is working on that. So we're currently working on a new study in Jordan, focusing on the effects of the Hajati program. And I just want to give a little sneak preview and generate some interest for this work, which is ongoing. I cannot present any findings. But currently, due to funding constraints, this program is being scaled down. Now, this is not uncommon. In fact, the implementation of cash transfer programs, but also other humanitarian interventions, may not be closely aligned with the displacement crisis they are designed to address. In fact, program funding may contract while a crisis is still at its peak and displaced households are still in need of support. And we see that this is a finding that was also reflected in a recent report of the Interagency Standing Committee, which concluded that limited predictability of donor funding leads to what they call a short-term programming focus and also start-stop operations with suboptimal execution. So what we're trying to understand in this study is what are the impacts of removing cash support in these kinds of humanitarian settings? How do households deal with this kind of volatility and uncertainty? And we hope that this research will feed into new discussions about funding of humanitarian interventions. So for those interested, I hope that you will stay tuned for the results. Thank you very much.
Thank you, Jakob. And 183 of you are still with us, so thanks for hanging in there. I know this is the moment, given how we schedule our lives in 2018, when a bunch of you are going to disappear from the webinar and move on to other commitments and appointments that you've made. But for those of us who are able to stay with us, we do have a variety of really interesting questions here that I've regrouped into 4 categories, really, that I'll go through one by one. A few just comments from myself listening to all of this. In the first presentation from Amber, I was amazed but not surprised that the studies were looking, did not overlap between those that were looking at intimate partner violence or violence against children, but not looking at the family systems. And I think we heard that repeated in Tia's presentation as well. And I think that is a gap that we, all of us across these fields have identified and really need to work towards. I was also amazed to learn that only one of the violence against children studies had a mixed methods design, and think that's a real wake-up call to all of us to improve our method so that we're incorporating the best of both quantitative and qualitative work. And finally, Jakob, even though I work in a research institute, I've learned a new research design, this geographical regression discontinuity. So I'll have to look that up. In terms of the areas of questions that people have sent to us, the first, and I will ask these to all of you, and maybe you can each take a turn answering the ones that you can, and we'll do your best. And if not, for those of you participating in the webinar today, we will share the presenters' contact information in the follow-up email as well. There are quite a few questions around the kinds of cash transfers and the outcomes. So Michelle Hines, for example, has asked, do you have a sense of variation of findings on IPV reduction based on the type of cash transfers? Another question from Maggie Cruz in the same vein, have you done any studies comparing the use of cash transfers versus implementing savings and loan groups and the impact that these various approaches have had on IPV and women's agency or empowerment? There is a little bit of a standalone question about child marriage outcomes from Arwin Finney. Did any of the studies specifically look at child marriage as an outcome of cash transfer programs? Or are you aware of systematic studies that have done this? So another area of questioning is really around the recipient. And we had four questions, or four groups of questions that really fed into this line of questions. Maimuna Lehman asked if there are, these are questions about women as recipients of the cash transfers. Are there good practices on how practitioners can make sure women can decide without fear what to do with cash instead of investing it fully in the family or trying to please their husbands in an attempt to bring peace to the household? Were there mitigation measures undertaken for domestic violence if that violence was triggered because of the cash transfer to women in the family? And Maimuna notes that in some of her experiences, women may have access to the cash transfers, but may not be able to satisfy their own basic needs or really decide what to do with it. In a similar vein, Clara Aleman has asked, are there differential impacts of the LEAP program depending on the family structure? How were the cash or benefits of the program delivered to one member of the household or to the household together? And if it was to women, how was the person chosen in the case of polygamous households that had several wives? A similar slightly broader question from Tijani Mahmood about the LEAP program. Did the program make a link between the recipient of the transfer and reductions in IPV or other outcomes? A third area is around government involvement. Eugenia Lopez Uribe asked if you could share which sector of governmental institutions or kind of governmental institutions were implementing cash transfer programs. And Verena Demerau asked, when Amber talks about government-run programs, are these also financed by the government or presumably by an external agency or an international monetary institution? I hope that Maimuna's question around emergency settings has been answered by Jakob's recent presentation. Finally, a question about negative outcomes from Glenda Palacios. What are the negative incentives that this kind of transfer can generate? For example, qualitative evidence from Colombia shows that women increase their rate of pregnancy to get more cash from the government. So I think this notion of dependency or seeking, undertaking what are presumably undesirable outcomes in order to get more cash, certainly part of the narrative of many places in the world, and is something that we need to consider as we discuss these. So over to each of you. Maybe we can do them in the same order that you presented in, Amber, then Tia, then Jakob. We'll try to get a few more questions in after that as well, but I also want to be conscious of your time. So over to you, Amber.
Sure. So thanks everyone for the interesting questions. I think the question from Michelle on in terms of what types of cash transfers we were finding reductions for, I mean, we're finding them in almost every type of program. So we're finding them in conditional cash transfers as well as unconditional cash transfers as well as bundled programs. But as has been pointed out, there haven't been comparisons kind of neck to neck in the same study comparing these different types and then looking at differences in outcomes. So I think, yes, that would be very, very interesting to do, and there are studies that have done that in looking at other kind of more general outcomes, but not IPV. In terms of the recipient, I think this is really interesting. I mean, we've seen that in most of these programs, the cash has gone to women, where we found the reductions, but there have been a few cases where the cash has been randomized to men and women, and reductions were found in both types of programs. And there's been a recent study looking at Mali's national cash transfer program where the cash was given exclusively to men as heads of households, and there were reductions also found in that setting. So I think, you know, there's not kind of a one size fits all, but we seem to be seeing these types of reductions across different program typologies, and I think, yes, the next step is to kind of go to look at comparisons between the two if we think that kind of this is an important enough line of study for these kind of general cash transfer programs. I just wanted to touch quickly on the negative outcomes. So I think it is important to highlight that, you know, there is potential for negative outcomes. Despite that, we haven't seen a lot of it showing up in the reviewed studies so far. But one kind of negative outcome that I did want to highlight, because it is in our framework, is that around increased spending on alcohol and tobacco or other temptation goods. This is kind of one of the pathways through which there could be increases in conflict and violence. And we don't really see that within our studies or within kind of the broader literature on cash transfers. And that's not to say that that's not happening, but just that we don't actually see a response from the cash transfer increasing that behavior. So I think that's important to point out. And in terms of the government agencies, I think these are traditionally social welfare agencies or agencies of gender, disability, social welfare. They kind of vary across the countries. Often these programs are initially donor financed, and then the hope is that they will be, you know, the budgets will be kind of, the governments will increase their budgets over time. And there's a nice, a very long report that the World Bank just put out on realizing the potential of social safety nets in Africa that kind of gives breakdowns on financing, which is quite interesting if anyone wants to go and, you know, get more detailed information on that. So I'll pass it to Tia.
Just unmuting myself. Okay, thank you. Yeah. So on the question around so we did find differential impacts by family structure in the Ghanaian study. We found that there were reductions in overall and frequency of IPV more strongly in the monogamous households and less so in the polygamous households. And in theory, the targeting of the program is based on the structure of those households. So it's based on living arrangements and cooking arrangements. So in theory, the program could target multiple wives in a polygamous household that are determined to be separate households. In the qualitative evidence, what was interesting is that when we went back women talked about sharing the cash amongst their co-wives. And so you can see how the cash would not go as far if you're sharing that monthly transfer among multiple households, as we define a household. On the fertility question, so you bring up some evidence in Colombia. Overwhelmingly, the reviews of evidence in primary studies suggest that cash transfers do not increase fertility. So we see evidence from Latin America, also evidence from Africa, where cash transfers are having either no effect on fertility, so or we also see evidence that it's allowing increases in birth intervals. So evidence from South Africa shows that women who were receiving a cash transfer actually had longer intervals to a second pregnancy. From the African context, we also see some reductions in adolescent pregnancy as a result of cash transfers. And so, similar to the evidence that Amber mentioned of the reviews that show overwhelmingly cash transfers don't increase alcohol spending, they also largely do not increase fertility, though there may be some exceptions like the study that you referenced. On the child marriage outcomes, there is also some limited evidence around child marriage. We see in, for example, there was an NGO study or an academic study, not a government program, that saw delays in marriage in Malawi. So a study by Baird and colleagues, the Zomba study. There have also been some suggestive evidence coming out of Ethiopia that the productive safety net program there, it's changing the demographics of the household. So it looks like there are more female adolescents in households that are receiving the cash payments as opposed to those who don't, which suggests that maybe this is due to a delay in marriage. So there's less strong evidence that these cash transfer programs are delaying evidence, but there's very strong evidence that it's affecting some of the pathways like economic security and enrollment of secondary school age children. So overwhelmingly in Latin America, in Africa, we see that cash transfer programs targeted to the households do increase school enrollment and attendance of children, particularly those of secondary school age who are at higher risk of marriage. And then I think that the question about how do we make sure women can make the decisions about the cash, this is a difficult question, and it has been addressed in different contexts in different ways. So sometimes the cash transfers are completely unconditional. Sometimes they're conditional on school enrollment and health checkups, particularly in the Latin America region. So that's going to affect what some of the transfer has to go to, because even though some of these services may be free, there are opportunity costs, transportation costs, etc. And then in the African context, the government programs are largely unconditional, so households are free to spend the money how they want, but oftentimes there's soft messaging. So maybe when they enroll the households, they tell them that it should be used for the benefit of the children. So this might influence how households spend it. But I think these programs, because as Amber mentioned earlier, they're largely poverty reduction programs where IPV and violence against children is not on the radar of government officials. They're really not designing the program or adapting the program design to make sure that women can spend it in that way. So I think, there's a lot of interesting questions about that, especially as the modality of payment is changing. Increasingly, we're seeing cash transfer payments being replaced by e-payments. And so that also has implications for how women are able to control the spending, how people know when she's getting it each month or every other month. So I think that's an interesting area of research, but unfortunately not something we have very concrete conclusions about today. And on that, I'll pass it over to Jakob. Thank you.
Thank you. I think that the questions were not really directed at me, but more at Amber and Tia. So just two quick comments from me. In terms of the types of cash transfers in the settings we're working in in case of displacement, these are typically unconditional transfers, and there's a good reason for that. If you think, for instance, about the programs I introduced, they try to support children's school participation. But if children do not attend school, even in the presence of the program, there's probably a very good reason for that. And the last thing we would want is to punish children and households if they have a legitimate reason for not sending their children to school. So these programs tend to be unconditional. And then in terms of child marriage and early pregnancy, I could see that that could be of interest also for the setting in which we're working, but the programs very much focus on primary school age children, and we do not see marriage or pregnancy rates with sufficiently high rates that we can say something about them in our study there. I'll keep it at that.
Thank you, Jakob. And one quick question that came in was about when the Hajati results will be ready and online, from Naja Gizge.
Of course, we want to be optimistic and do it quickly. We're aiming for a report around April, but knowing this setting, things can change. Yeah, we're doing the best we can to deliver it within that time frame, but it could be later.
Great. We are at an hour and 15 minutes, but we had a few more questions come in, so I think we can run through these. Of course, people who need to leave will just do so on a webinar platform. Annie Horrocks has asked if you have seen studies regarding the use of unconditional cash transfers as a service response to gender-based violence, for example, as part of case management activities. Lisa Lauman is asked about insights you may have about how recipients have been prepared to receive cash transfers, their expectations for use, prior training about how they plan to use the funds, and etc. And then a final question from me to bring it back to the practitioners. I know we don't live in a simple world, but if you were to try to give each of you, and I'd love to hear from each of you, one key piece of advice that you would give to practitioners doing cash transfer programs to make their work more likely to promote safer families and households, what would that one key piece of advice be, given the state of the evidence today? Over to you for one last round of questions.
Okay, so in terms of the unconditional cash transfers as a service response to GBV, we didn't have any of this type of program in our review. However, the Cash Learning Partnership does have, in collaboration with the Women's Refugee Commission, they do have a toolkit that kind of walks through a number of kind of similar type programs in emergency response and providing cash as kind of a way to access services or, as you say, a service response to GBV. So I think I would really encourage you to go and look at that toolkit because it is quite interesting in that we kind of came at the question from different angles and kind of uncovered and different types of literature. Their toolkit tends to be very focused on practitioner responses and case studies, while ours was more focused on kind of development settings and the academic literature around this. So I would say that yes, it is happening. There are people experimenting with that, but that was not kind of, it wasn't part of our review as it didn't show up in the academic literature. And then I think I'll just go to the key piece of advice. I guess we've seen quite an interest, I think, in cash transfers and the potential of cash transfers and social protection to affect gendered outcomes and to kind of shift the balance of power in the relationship. And I guess kind of the view that I saw when I kind of started doing research around this area was that cash was a risk. So a risk for disrupting power relationships in the household and increasing IPV. And so I would say, I guess, that, you know, while it's still very important to do kind of pre-assessments and look at gender dynamics and carefully adapt any intervention or cash transfer to the setting you're working in, that we should, you know, try to leverage this, and we should try to be bold in this area and not always think of this as a potential risk, but more as kind of a benefit that we can, you know, capture in these settings. So I'll pass to Tia.
Great, thank you. So to the question of how are people prepared before when they get enrolled into these programs and how to spend the cash, I mean, the answer unsurprisingly is it varies widely. So it varies not only across countries but also within countries. So even where we see unconditional cash transfers, sometimes district officials will take it upon themselves to recommend to households how they should be spending those funds. And we've even heard scenarios where district officials will say, you know, we check to make sure they're spending it on what they're supposed to spend it on, even though it's an unconditional cash transfer, which means they can spend it on anything they want to, because the idea behind cash transfers is that people are empowered and they know best how to make the decisions about how to improve their well-being and the well-being of their families. But sometimes there are also savings groups. For example, in Tanzania, recipients, households that are receiving these cash transfer programs are sometimes organized into savings groups. And so there may be some financial literacy training or training around the savings groups, but it does vary widely. And as for the key recommendation, how to make households safer, I think I would just go back to the recommendation around how Amber highlighted that there's very little evidence around the effectiveness of linkages, but I do think that linking households, these are very vulnerable households, and what's exciting about government targeted household cash transfer programs is that these are reaching some of the most vulnerable households that are often not reached by other types of programming. And so there really is an opportunity to link these households into other services. And UNICEF is working in a variety of countries trying to do just this, link these vulnerable households to other services. And I think what we should try to really emphasize is how do we link them to existing services instead of trying to replicate parallel systems that may disappear once the project funds or the donor funds go away. So how can we further integrate these marginalized households and link them to services that are already existing?
All right, I'll finish with my piece of advice to promote safer households. It builds a little bit on the question whether unconditional CTs have ever been used as a service response to gender-based violence. My piece of advice is not building on the programs in Jordan or Lebanon at all, but it is not to target cash transfer programs on negative outcomes. It's an issue that we see pop up in discussions at least every now and then. Fortunately, I've never seen it in practice in the program, but if a program is targeted, for instance, to children in child labor or children who are married or couples experiencing gender-based violence, then you might actually promote the type of behavior you're trying to prevent. So that's a very practical and hopefully quite obvious piece of advice.
Thank you so much for that. Well, participants, 110 of you hung in there with us through the whole hour and 23 minutes, but I think it was obvious why. We really had the all-star lineup of people working on this. Thanks again to the presenters, Amber, Tia, and Jakob. Thanks to all of the many co-sponsors of this, the World Bank's Gender Group, the Alliance for Child Protection and Humanitarian Action, the Transfer Project, and I hope I'm not forgetting anyone, UNICEF's Office of Research in Achenti, of course. We will follow up tomorrow with all of the presentations, a recording of the webinar, which we'll have up on YouTube by then, and hopefully, even though this is still a work in progress, and as researchers, I hear from all of you that you'd love to keep learning more, which of course we all want to do. I hope that we can be integrating some of this really important that you're learning that you are developing and consolidating for us. I mean, this really was, to me, like a masterclass in where we stand on cash transfer programs and intimate partner violence and violence against children. So thank you for your time. It has been a tremendous learning experience, and I am very confident that this webinar in particular is going to have pretty important impacts for the way that people do their programs. So thanks for sharing the learning. Thanks to all of you, hundreds who joined us, and let's hope that this webinar recording goes viral. Let's make it the first child protection webinar to go viral with a dream team like this one presenting. Thanks to all, and have a great evening or afternoon or rest of the morning, depending on wherever you are. This was Mark Canavera for the CPC Learning Network, and thanks so much. Bye, everyone.
Thank you.
Mark. Thank you.